Everybody to the Jiggy board meeting of the Bartlett Regional Hospital. Your call to order. Now, please.
Yes. Through the Plinkett Haida and Tsimshian people, we respectfully acknowledge them as the original inhabitants of Southeast Alaska. Bartlett Regional Hospital is located on the homelands of the Akwaan. We're grateful to provide services in your ancestral homeland and to be part of this community.
Thank you, Tom.
Chris Letterman.
Here.
Dr. Kingy.
Here.
Max is absent tonight. Lisa Peterson.
Here.
Al Geiger.
Present.
Phoenix Solomon Gross.
Here.
Kelly Deering. Dr. Rester.
Here.
Deb Johnston.
Here.
Dr. Mather down there, and we have Steiner virtually. Good.
Okay, I would. I would entertain a motion for approval of the agenda.
Madam President, I make a motion to approve the agenda as presented.
Second, Lisa. Do we have anybody from the public online or here? We heard from? Okay, we're seeing that. I would like to introduce, or have Joe introduce our new CFO.
So after about 9 months searching for a permanent CFO, we found a in the rush. Angela came to us from down south, so she brings many years of healthcare experience. So we brought her up in late May, did a good interview process. Staff absolutely loved how she interviewed, so she agreed to join us here in Juneau. So today, our first day was yesterday, actually. She's fresh on the ground, so behave yourselves tonight so she comes back. Welcome.
Good to have you. Thanks. All right. I would now entertain a motion to approve the consent agenda.
Madam Chair, I move to approve the consent agenda.
All right. Let's move on to old business, hospital capacity.
Thank you, Madam Chair. For our hospital capacity update, CC for our patient days in May, CCU had 111 patient days, Med-Surg 450, MHU 163, OB 68, newborn nursery 43. The emergency department saw almost 1,200 patients last month, which was up about 100 from the month prior. We have a total of 9 waiting for placement, 3 of those for subacute rehab, 2 for assisted living, and 4 for long-term care. And then we have had extremely high census through the summer, higher than we've seen in the years prior with preseason. And it's a combination of not having any more beds left and then some with staffing. We are working on what we're calling a code triage plan, which is a hospital capacity plan, to look at what happens when we're at capacity and can't take any patients from outlying communities. And we'll be updating the board as that comes into play. I'm happy to answer any questions.
Any questions?
I apologize. I think she got went on a call with a patient earlier, so I can pull up the information here and then I can give it up.
That would be fine.
I'm sorry.
Can you do that?
I just pulled it up here. It was just, it's my computer. So the information for home health and hospice is in the packet. For home health, they had 13 admissions. This was as of 6/16, with 1 recertification in the month of May. There's 11 admissions pending. 14 that are currently in service, so they're fairly busy. On the hospice side, they've had 7 admissions for the month of May, and then 7 currently are receiving service. They are a little bit happy to report a little bit overstaffed. And we're okay with that. It'll give them an opportunity, I think, to come into alignment with some of the staffing changes that have happened. So they're getting those new staff oriented. 2 of them, one of them, the traveler, 2 of them are actually employed by Bartlett that have experience. So they just started this week, and as it goes out, we should be able to do more things with the program as far as education and community outreach. And I'm happy to answer any questions.
I'll Clark Court.
Hi, good evening, everyone. Today we are at census 55. We've had a couple of discharges on an admission this week. We're anticipating another admission this week, and we are currently reviewing referrals from the hospital as well as the outlying community. Potentially a couple of discharges coming up that we weren't expecting, so maybe look for more people coming in. Our numbers dropped just a hair, but we're going to see that little variability, with discharges and admissions, but looking to be steady for our case. Our new CNA class is well underway, and clinicals will be starting soon. I spoke with one of the members in the class this afternoon as they came back to the building, and we're very excited to be in the class. So really appreciative of the opportunity to move from, kind of an ancillary position to the CNA role. That was a good report. Any questions?
What would be the rough percentage of travelers versus staff? On what would rough ballpark?
24%.
Oh, exactly. Travelers.
And that is licensed nursing staff and certified nurses together.
Thank you. If I may continue, what would our Bartlett Hospital be? I wonder if anybody else knows that. In the OR, I would say it's about 60-40 traveler. Also because of call issues. Yeah, maybe 50-50.
Do you think we have more travelers
I
than staff?
agree.
And through the chair, I think we have more travelers in OR. I know we have 4 travelers on Med-Surg. We have 2 travelers up on MHU. We have no travelers in CCU. And currently, the majority of our emergency room staff is travelers.
Any other questions? Any overall?
Staff.
Well, and that's not including, some travelers in diagnostic imaging and in physical therapy. I would say we have, in my opinion, I think we have the highest amount of travelers we've had in a while at Bartlett.
And
To the chair, at last count, we had 67 travelers total.
is there anything you can attribute it to? I mean, is there some shift that's happening or?
Thank you for that question. When I was talking to my counterparts across the state, they're all experiencing the exact same changes with staffing. Nobody can really identify it. That's everywhere from, Providence, ANTHC, search, they're all having the same kind of issues with finding staff. So I don't know if it's a change in, where we saw a shift where a couple of years ago or, 5 to 7 years ago, we knew that kind of this older generation of nurses were going to start retiring or getting out of bedside. And we're seeing a large influx of younger nurses. And I honestly think that the demand of work-life balance has changed for that generation. And so we're seeing less people wanting to do the shift work, more people wanting consistency of a Monday through Friday, less people wanting to do nights. And so I think that all kind of adds to it, the populations. I think they're trying to search out places that fit their lifestyle better.
What about the, and I guess it hasn't gotten any better, but, or maybe a little worse, the social side of it, the community side of it, of recruitment. Do you find you're having more trouble because of the lack of housing, the lack of childcare?
Yes, through the chair, that's a huge part of it. We've had, I don't know, 11 people rescind their offers because they couldn't find housing. We currently have 2 RNs that are BRH employees that are being asked to leave their housing. So they're currently looking for housing, and they've indicated that if they can't find housing, that they'll be leaving Juneau. So we're trying to be creative and innovative on how to try to keep those folks here, but it's really difficult when everybody, the city and other organizations are all fighting for the same amount of housing, right? So we're doing what we can to try to provide that support.
I'm here, and I'm glad Neil's online here too. It's crazy because our population in Juneau has dropped by a couple thousand people recently, in the last few years. And we've actually added over 1,200 units to our population or our community. And still housing is the #1 crisis, you know. Before you said that, I was going to say, I know there's been several people that have rescinded their offers, already agreed to come here, and then because of housing. So I don't know what we can do about that. It's a real big challenge. I know that in the package Joe talked about, there's a possibility for Bartlett to actually buy an apartment complex or something to maybe get temporary housing for people that are moving up here. Maybe incentivize that for us to get people to come to Juneau and work full time and not be travelers. So.
It's topic of discussion, but you want to?
Yeah, we discussed that at length during the finance committee, and the finance committee has asked us to prepare some documentation, what our needs are, kind of purchase versus lease options, what we would look at. And so we're bringing that back next month to finance for further discussion. I see we're going to bring that with planning too, hopefully.
Yes. We're talking about either sequential or a joint meeting to discuss it.
Just follow up to that on the childcare piece of things, and I think I've talked to you in the past about it. I mean, I know of at least a few nurses who don't work full time because of the limitations for childcare and the cost of childcare. I mean, has the hospital investigated that avenue for the people that are here and are already working but aren't able to work in full capacity due to childcare conditions?
We've looked at childcare, but due to us having PERS and us employing and having our own childcare, we would be the most expensive option in Juneau, probably trying to run it ourselves. We need to explore, I guess, is there options for us to just secure it through a vendor, but we are taking a limited resource and just locking up a piece for ourselves. And does that drive costs up in Juneau?
And I think it's just space, right? I mean, it's not, cost isn't the issue. It's not whether you can lease it. At least in my exploration of it, it's where they're actual spots. So, I mean, it's less about whether the hospital can guarantee spots and or can you create more spots at a reasonable cost. And that.
I said my note, Chad, we've discussed in the past, we would visit that.
It's an issue in every industry town, trying to find it. The city's experiencing it, which includes us, but the other industries finding the same thing. Any other answer? To the foundation.
Sure, thank you, the chair. Our application period for the Grace and Phil Edelman Scholarship has closed. All of our scholarship committee members have been scoring as they have had time to do so. We are meeting tomorrow for our final meeting to be able to select those applicants. So we should be hearing something back later tomorrow. The enrollment drive from Gift from the Heart campaign is still currently at 34 employees contributing $580 per pay period. We recently hired a part-time admin assistant. She'll be working up to 15 hours a week, so just very short. And she'll also be helping us with a little bit of hospice and home health events that are going to be coming up this fall and winter. Foundation investment in Bartlett Hospital through the 16th is listed below. We've paid for most recently the infusion center headpieces, the foundation PICC line training, the scalp trainers, and then the other big one was the training for the emergency department. That one's $11,857. Our next quarter foundation board meeting is July 22nd. We just booked that, tried to get on Joe's calendar before we could. Anita says, you better nab him now. So I got it quick. August 1st and 2nd, we're looking at doing a Bartlett staff wellness activity. The evening of August 1st will be adults. The August 2nd activity will be for staff and their children. So we're planning that now. It'll probably be like a paint type thing, and the kids will be a cookies and canvas type thing with some alcohol painting. Looking on that. You've probably heard the rumors, the Hot Shot Coffee Shop is closing mid-August. They were not able to make it a viable opportunity for them. We're looking at some other options. We have conversations with the Grind and Flying Squirrel, but we're also looking at the potential of having a sole proprietor come in and find the right person. That being said, I don't think the foundation is interested in becoming the coffee shop business. So we need to find someone that can be able to procure that and take over. So I know it's important to staff. In speaking with the current barista, she seemed to think that 90% of their people that come through there are staff. They haven't seen as much tourists as she thought they would. She thought maybe a sign downstairs directing them upstairs might help, but really it still sounds like that 6:30 staff change is the best time, and they weren't really willing to kind of be open during that time. So that's part of it. So anyway, we're working on some different options, but if anybody has any suggestions or opinions, feel free to reach out and email me or stop by the office. Any questions?
All right. So move on to new business and Chris. Information system
Okay,
security.
gotcha. So this represents the full security posture of the hospital. And I want you to think of these concentric circles three-dimensionally, so that the one in the center is the highest up. And all of them are supported by those that are larger. Meaning that as we talk through these different areas of focus, they are all dependent upon the foundation laid by the wider circle beneath them. So starting in the center, that's our endpoint security. Those are things that we're familiar with, like antivirus software. We have compliance policies that run on the computers that can harden them or configure things about how they operate. And then running out to like network level, we can do things like filter DNS records. That stands for domain name system. Lookup, where you type in a word and that resolves to a web page. It's a numeric to alphanumeric transformation. We have a product that filters what is requested based on a reputation score, and 5,000 times a day, that product blocks someone from within our network from accessing a URL that is deemed to be unsafe. We also segment the network. So sometimes it's physically separated, like totally separate switches. Sometimes that's virtually separated through VLANs, so that in the event of a compromise, there's less ability to spread across critical systems. And then Cisco ISE is a feature that we're just about to implement that will tie traffic to identity, which will help in remediation of any sort of compromises. And then beyond that, edge is where our network, the edge between our network and the intranet, we have things like a firewall. We have processes that like classify data and apply protections to them so that in the event of like data exfiltration, the data isn't usable. We have a security operations center, and we have multi-factor authentication, which I'll talk about a little bit in more detail in the next slide. But the firewall, about 200 times every day, blocks something that is identified as a known exploit. So this is some known vulnerability in something within our network, and an attacker, an external attacker, is trying to leverage that known exploit. So it's a totally critical piece of software, but that just does paint a picture of how common the threats are. And then the widest circle here is policy and procedure. It's what everything else rests on. And some examples of policies and procedure is we have policies on how we allow people to access our network remotely, that we require multi-factor authentication for identities, acceptable use policy, what can you do with your computer, data classification policy, and of course procedures, which is, how do we deal with a compromise? What is our disaster recovery plan? What sort of inventory controls do we have so that we know what we have and we know that it's all sort of safe? And sort of interesting thing about visualizing it like this is that the most important, most foundational portion is that policies and procedures portion. It's also the free portion. It's the part that costs no money, and it's just about creating that foundation for the rest of it. So I'll pause there if anybody has any questions about security stance of the hospital.
Guess I would give a preference. I just asked Chris to come give a presentation so you guys understand like all the steps we take to secure our infrastructure, our IT infrastructure, level of security. So that's the onus, the kind of the reason behind this presentation.
So something we've been working on this year is multi-factor authentication. So when you sign in to a program and you use the username and password, that is something you know. You know your username, you know your password. Multi-factor authentication is the concept of adding a second factor, which could be something you have or something you are. So something you have might be a hardware token or your phone. Something you are is like a biometric, like fingerprint or retinal scan or something like that. So it is the lowest hanging fruit in the security interventions. It by itself, between an environment that has that implemented and one that doesn't, can account for a 99.5% decrease in the probability of compromise. So we have written a policy this year and ratified that policy, stating that all Bartlett identities will have multi-factor authentication. The first constituency to have this implemented with is staff. So all staff, our deadline is that all staff are multi-factor authenticated by June 30th. We also participate in the city's umbrella cybersecurity insurance policy with the police department and city. And that has a requirement of multi-factor authentication for remote access. So we are currently, I think the next slide will tell us where we're at. We've had some, here's the policy. If anybody's interested in the MFA policy. And you can keep it going. This was our communication plan, how we rolled it out. If you go one more, here's a demonstration of some flyers that we hung up around, and we made the lock screens. Here's the actual numbers over the weeks as we have enrolled more and more staff. You can see the 100%, it's broken out by department. If you scroll down, I think there's a bar chart that's coming up. That's a nice summary. My chart. So we're at 86% as of last Friday, which is approximately 67 or so individuals I happen to know that quite a few of those have signed up in the last week, just in the last 5 days or so. So I think we have every reason to expect that we'll hit 100% by our deadline. And yeah, does anybody, I have iPads here that I brought to enroll the board, like extra authentication as well. So after the meeting, I'd be happy to do that for you. But does anybody have any questions on anything?
I do. I'm kind of a Luddite and educated by the century. So I have MFA and I use it for accessing stuff remotely, right? But I'm in the hospital and when I sign on in the OR, I don't need it.
Right. So we actually exclude the requirement while you're on campus. So you won't be prompted on campus.
Thank you.
And it's important, even if there are Bartlett identities that aren't remotely accessing, it's not essential function. They don't check email from home or do anything outside of the environment. That isn't to say that someone attempting to gain access to that identity isn't doing that. So it's important that even if you never encounter an MFA prompt because it doesn't have anything to do with your work, that we still have that control in place.
It would be just a point. We have an executive session after this, so I don't know if we want to entertain having a break for a couple of folks so that Chris doesn't have to stay here until after the executive session. I don't know what the will of the group is.
That's fine. Take a break.
Okay. If we don't mind going into executive session a little bit late, maybe you could capture a couple more of us without having to wait until after the executive. All right. Thank you. CEO evaluation.
Thanks, everybody. So the governance committee met this past week and a half ago, give or take, 2 weeks ago. Last week. Time flies when you're having fun. So in doing so, we went through a kind of draft of what the CEO evaluation could look like. And after that meeting, Hal and I exchanged some emails back and forth and came up with the following draft for the board to discuss. Particularly, one of the decisions that needs to be made is in section 2, which is the organizational goals and board goals, is to provide a weighting system for those goals. Outside of that, you'll see some differences. In section 1 is specifically for the board. Section 2 is also specifically for the board. Section 3 goes down to the medical staff executive committee. So they're asked very similar questions, and it includes both a combination of qualitative and quantitative responses, so we can trend things over time. Section 4 is the senior leadership. I apologize. Section 4 is senior leadership. Again, same questions in the qualitative. Section 5 is optional. That would include the union presidency to provide some additional feedback. And then optional section 6 is city leaders and additional community stakeholders as the board saw fit. From there, section 7 would include providing goals for the upcoming year so that the CEO understands clearly what they're expected to accomplish over that upcoming period of time. So again, this is something that Hal and I and the governance committee discussed and wanted to bring forward to the board for additional discussion and see how everyone feels about that.
Can I just make a quick comment? Realize that Shelley has joined us. So, yeah.
Thank you, Chad and Hal, for working on this. So one thing that is glaring that in my mind is missing is I really believe that a CEO evaluation used to be a 360 evaluation. I don't see any section involved with this.
Apologize, that is included. The CEO would be providing a kind of his scorecard as he has in the past,
So,
was my intention.
follow up, good.
Yes.
So, what I like to see in an evaluation for a CEO is I really like to see the CEO give his evaluation first. And I really like to see where the CEO feels he's at. Okay, so as myself as a board member or whatever role I'm playing on the board, it's important for me to know our CEO is Joe, so we'll just call him Joe. So Joe can provide that feedback to us as we evaluate him, because, I believe that us as a board, as a president, that it's important that there's constantly feedback going on to Joe during the whole course of the year. So there's never a surprise in any type of evaluation. So I just want to make sure that is clear, and when this is given to the board to start doing their scores, that they will see where Joe feels he's at before they start putting in.
Absolutely. We can make sure that's more clarified.
I think Chad covers, but just to be absolutely clear, one of the things that we're asking the board to do tonight is to look at these weights in section 2 and put numbers in there. This meeting with numbers. And as we talked about it, and I just put some of my cards on the table, looking at that first one, maintain an operating margin of greater than 2.5%. For me, that should have a very high weight. And, I would like us to, personally, I'd like to see us put a big number on there. Expand orthopedic services, that's important too, but not nearly as important as maintaining an operational margin. Increasing employee satisfaction, that to me too seems to be a very important one. So I'd like to see a big number there. But I think we need to put those weights in, and then I personally think this is a simpler evaluation process than what the board's gone through in the past, and I think the simplicity has some big advantages.
I'm sure if I might, one of the things that to me is very important is that whatever we create is we can use it consistently. I think one of the reasons why we've been able to see and track employee engagement is because we've been doing the same survey now. We're going to continue to do the same survey. And so if we really want to be able to track the progress of an employee or of anybody, to have that consistency. So my hope is that whatever we decide on, that we're not here next year saying, well, we didn't really like that, let's change it. That we kind of agree to like a 5-year, 3 to, some sort of time frame where we're going to give this a shot, and it's going to give us what we need to track a trend over.
Any other comments? I have a couple, and then we need to open it up for more discussion, I think. From my perspective, these 4 goals are dynamic. These are not, we may have 4 goals, but they may not be the same goals from year to year. So you're not saying to
Correct.
keep
Yes.
5 years.
The goals would change on an annual basis. For sure.
But the tool and the process.
And the qualitative and quantitative questions that are being asked of the board and the Med Staff Executive Committee, senior leadership, and if you elect to include the union and external parties, that those would stay the same year over year. But of course, the goals would be nuanced based on you guys' targets for the upcoming year. And there are 6 goals. There's 2 more on the second page.
Okay. Did I see the other 2 goals? Well,
Madam Chair,
go ahead, Shelley.
question I have, is it normal to have the union evaluate the CEO? Or provide input?
I can't answer that question. I have not worked at a organization, so. But John,
Through the chair, I would say that it is uncommon. I think it's important to understand or to remember that the real delineating factors is what the board's responses. Everything else that's being provided is simply input for the board.
Yeah, I think I was saying the same thing you did, but in a slightly different way. Our intent is that the CEO's evaluation number, we put it in a number, that will come just from the board. That's it. We're asking these other entities for information to consider. So the board members in this room and those who are missing will fill out section 1, section 2. That will pretty much determine what the CEO's evaluation is going to be. But reviewing these other entities, the medical staff, whomever else, we might tweak it up or tweak it down a little bit, but we might also then use that to set goals in the evaluation statements for the next year. That was our intent. So to be redundant, hopefully to be clear, the CEO's evaluation score will come from the answers in section 1 and section 2 primarily, or almost exclusively.
any did you have?
So I actually think you wrote this out really nicely and explained that in your explanation. Again, before me as a board member, I want to put a score on Joe. I want to know, especially if my evaluation number is going to be the one that counts as a board member, I want to know what everybody else says. So before I do my evaluation, I want to see what Joe thinks of himself. I want to see what the senior leadership thinks. I want to see what the med staff thinks. I want to see what the union thinks. And then I want to do the evaluation, because then I have all of my tools are in my tool bag, and I can draw from them to see what it is. So I hope that's what you're planning on doing. If you're gonna do the evaluation this way, I think that's the most important. Because what I feel like here, and again, too, you're explaining it, it's the same way you've written it, is that, okay, I'm gonna do the evaluation, the board's gonna do the evaluation, we're gonna get now all these pieces together. It's gonna all go to Chad, Chad's gonna give it to us, and we're gonna say, well, we need to tweak it up or down because people scored it differently. I think that I would rather have all the tools in my belt before I make my scoring decisions.
Sure, that makes sense to me.
I don't disagree with that either. The rest of the board, are there any comments from or disagreement from?
I appreciate it.
Are there are there any questions or comments about the goal section? If we go back to the to the 6 goals.
You're talking about the weighted measures that we're talking about?
Yes. First of before we start assigning, these are basically the goals that were given to Joe. I don't think the full board, we picked 6 goals and these were the 6 goals. It didn't work out quite that way. But this was the conversation that between Ian and at the time you and I was involved with it, but it wasn't we did not vote on these 6, propose them and vote on these 6 goals. So these 6 goals are the operating premise that Joe, the premises that Joe's been operating under. We can't really change them mid-cycle. We could ask him to, in the last few months of his, or ask him to make a little bit of a tweak or swing. But I just want to make sure that because we as a board did not formally adopt these as, or any formal adoption of the CEO goals, that we're all behind these goals, Kenny.
And Chair, we did present these goals to the board. The board is fully aware of what our goals were. A formal adoption, I don't know if that happened, but it definitely came to this board. This body saw what was expected of the CEO when he came here.
I agree with that, but I haven't been able, unless Anita, you, yeah. So I just wanted to make sure, because there was no formal adoption of the goals, and we've got them now set in his evaluation, that Joe, do you have any feedback on these? I know this is what you've been operating under, and any of the other board members, but before we move forward with the weighting process.
Now, as I stand in the governance committee, these are the kind of the goals I've been using as guideposts for how we move the organization forward.
Any other board members? Shelley? Are we good with? Okay.
I'm good.
Okay, now let's talk.
Well, since I'm not hearing anybody else throw out some numbers, I'll just do it. I think we should look, just going from one down. I'd like to see a weight, and these weights should be just given in percentages that sum to it. That's in the memo, I think. So I would start with maintaining the operating margin above 2.5%. I'd give that a weight of 35%. Increase employee satisfaction, give that a weight of 20%. Expand orthopedic services, I'd give that a weight of 5%. Develop a set of opportunities for primary care providers, I'd give that a weight of 10%. Improve physician satisfaction, I'd like to see that have a weight of 20%. Reduce traveler, I'd like to have that a weight of 10%, and if I can still do arithmetic, that should sum to 100.
Okay. Interesting. It's interesting concept with what you're proposing here as far as weights. Now, maintaining an operating margin of 2.5% is a goal. It's really important. I think we're getting there, but there's a lot of factors that could go into that I don't believe that high of a weight should be on our CEO to make sure that happens. We could have some sort of catastrophic event that could lower that. We could have reimbursements cut. There's just so many different factors that I don't know if 35% of our CEO's evaluation should be on how much money the organization makes. I just really strongly feel that's not, it's very important, but I'm just not sure that is what we want to make sure that I'm just not sure that's kind of what we want to put out there. That, you know what, it's all about making money. And if we don't make money, our CEO is not going to be evaluated that high. That's not how it should be. I know that our lofty goals really were to expand services, okay, and orthopedic services were one. And I would believe that expanding services would be something that is going to generate money. And I believe that would be something that would have a really good tie-in and have a higher number, high value. I don't know how high the number should be. I know that when you have employee satisfaction and physician satisfaction, it's going to really make your numbers go up as far as profit margin going up and as far as your margin going. So I think that you need about seeing margin of 2.5 has to be the highest number. I'm just not really sure that that's the most, I'm really not sure if I'm saying this properly, but I'm not sure that's the most important thing here. Although it is, because we want to keep our hospital running, but I'm not sure it's the most important thing as we evaluate Joe. Okay, I think it's evaluating the whole property, but not the CEO. I don't know if he has that much control on how much money we're going to make in this organization to save. Yeah. I really want to know what everybody else thinks.
Dr. Russ.
I don't mind it being number one. I don't know that it has to be 35. I agreed with everything coming out of Hal's mouth, except not so much the weight of the 2.5%, it's the traveler. You have that, I think, at 10%. I wouldn't mind seeing that bumped up a little bit. So if you're going to take a little bit off the 2.5%, I would throw it into that. And all the other relative numbers sounded pretty good to me.
How much would you take up?
I would take at least 5%, make it 30, and then 15 on the traveler reduction.
I've always wanted that to be one of our goals for the last 7 years. So I would make it higher than that. I'd make it maybe 20%, 25%. I think that's a really good point, Dr. Lester.
I can be the last person to talk, but if you don't mind, I'd like to chime in. I think that those two are the factors that Joe has the least control over. So while I want those to be top of mind for Joe, I don't want the good work that he's doing in all the other areas to be diminished in the evaluation process by a weight that by following a weight that is that he has the least control over. So right now, we talked earlier about the travelers, what's going on with the travelers. We, the board, the senior leadership and Joe cannot control the housing issues. We cannot control the childcare issues. I'm in agreement that it should be top of mind for all of us all the time, but it's so much higher than most of the other weights that it's a little bit of a setup.
So we've heard some numbers thrown around and some little tweaks, and it's impossible to keep track of all that. Could I ask, now that you've listened to what everyone has said, could I ask you to just propose a series of 6 numbers that add up to 100%?
Are you looking at me or him?
You or somebody?
I mean, you're looking this way.
Actually, I don't mind it. Joe's, been, yeah, I don't mind that at all. I don't, one or the other. You would be nice.
I'd make 2 points. I would slightly disagree with Kenny. I think the 2.5% needs to be weighted high because we look, our number one goal last year was getting back to sustainability. So the only way you can measure that is through an operating margin. So it might not be that way that much next year when we start transitioning out of this. It could change to a different number, but in year one, this has been our focus. And I mean, if you start weighting some of the other things, I could have the happiest staff and happiest doctors and no margin and expand services. But if I don't have an operating margin, it all falls apart. But I agree with how that should be weighted heavy. And going back to the locums, that flexes up and down. We've seen that number shift dramatically up and down depending on different swings and departments. I mean, historically, going back, me and Anita were going back through past board reports in 2000. You know what the number one issue was? The cost of travelers and locums. So this isn't something that is new to us. This has been a problem for 25, 30 years. So I agree, it's always top of mind. I mean, we've had the number down to what, 45 travelers, maybe Chad at one point, it swings back up. And so, I mean, it's one of those things I think we continue to battle and we need to battle it. I go back to Deb's point, it's tough to control. And depending on when you actually measure it, I could be doing really good or really bad.
So with that being said, and I totally agree with you, we really emphasized this last year that we need to get a upper margin. Deb is so correct, though, that those two numbers that we're talking about are something that you have the least control of. But I'm telling you something, I've been in this organization when we did not have physician satisfaction. And it was not a very fun place. No, I agree. And that is something that you directly, our CEO has direct control of. Employee satisfaction, physician satisfaction, making sure that the troops are playing nice on a nice field and are happy. And it makes this organization much more smoother. And therefore, it's going to have your operating margins going to go up. But just like I said, locums, people are going to want to stay here and move here. Chad, how many locums did we have stay here last year? That they came?
They came in transition.
Wanted to, at least. Maybe they weren't able to because of housing.
It would be, more than 8.
So 12%, 15%? 80?
Say 2% of the overall staff, 2%.
2%? I just think it's just really important that we make sure that we're really measuring. I know sustainability, the 2.5%, but more about things that you have control of, complete control.
Sorry, I said good job.
I look at these relative weights, not as whether or not he hits the mark, but the focus. And so even if Joe doesn't hit he hits 2.5%, 8 out of 10 times, or realize he's really focused on it, then I'm going to score him highly. The weights, I look at them as our board's perspective is what do we think is important relative to each other. So that's my take on it. And that's why I thought Hal's suggestion with my addendum, just bumping up locums, even though he doesn't have much control over it, I want it to be a focus. I think it's important.
Yeah, so Dr. Astor, I agree with your statement there, that if Joe's focused on cutting down travelers, the 2.5 margin, but he can't get there, okay? But he's focused on it. So that's going to lower his score. And I don't think that's fair. That's kind of what I'm saying.
But these ones are somewhat automatic. Either you get them, you either get above the 2.5 or you don't. And so each individual person is not going to be saying yes if it's no or no if it's yes. These ones are up above where we're going to ask the board members. The CEO effectively communicates and executes organization strategy. That's where the board members' chance to say excellent or poor.
We have not heard from several of our board members on that side of the room and online.
Madam President, as a member of the governance committee, I appreciated this approach in the development of this evaluation. And to the conversation that's happening, I do kind of want to reflect back that on Hal's last comment, any of these they're black or white, they're yes or a no. So the weight really is about, in my opinion, the focus of what the board would like to see. So, and because I have a unique perspective with being in the organization and Ian was here, I 100% agree with what Joe just said about the importance of the margin. There's no mission with margin. I think it was actually the CEO's letter. So I feel strongly that has weight, that has merit to be a highly weighted goal. And the only thing that I think I would maybe modify out of the numbers that you suggested trying to write it out on my pencil. Is the expansion of orthopedic services, Jim. I think that deserves just a little bit more than 5%. I think that's what you said.
If I may, if you put more weight somewhere, that means you have to take it out of somewhere. So it's not good enough to say put more weight, or unless you want to renormalize everything else and get into decimal points.
No, and my counter to that addition would be to decrement the locums because of the very reason that the president had raised. There's no quick answer to housing. There's no quick answer to childcare. Those are things that really are out of the CEO's control.
Dr. Cheney?
Yeah. No, I would echo a lot of the comments that have been made. As a small business owner myself, I think at the end of the day, the door's open, you gotta prioritize the operating margin. So I think Joe was right. The other weights seem logical to me. I don't want to beat a dead horse, but the locums thing, I think it's not. Kim made a good point. It's a cultural shift from young people today. They don't want to settle down. They don't, live in the same place and have a family. And as sad as that is the reality. So we're just not seeing young families that want to move and settle down and have a career in one place for a long time. And that's something that Joe has absolute no control over. None of us do. So, yeah, that's the only other thing I would say is, sorry, jumping back to sort of the evaluation. I think that, in my opinion, the value of having the board evaluate Joe, that value is increased if we do that without it being tainted or influenced by other organizations. That's just my opinion on that. Without reading Joe's evaluation of himself or this, that staff's evaluation, I think we get a better, just a better read or a better value in the evaluation. Just do it as a board. Without otherwise.
Everything that's been said before, I mean, like Dr. King said, I agree with that. I even feel even stronger that I think anything that is not within Joe's control is not anything we should be evaluating him on. That isn't fair. I also know this is going to sound really terrible, but I don't think we should be giving equal weight to what the union thinks or what other small entity believes about his work, because he doesn't serve the union. And I agree with Dr. Tingey's point that I think the board should do the evaluation. I'm perfectly fine with seeing what other people view, but ultimately I'm not going to change my weight or my opinion of the things that really matter because of what some of the other entities might think. Maybe that's being narrow-minded, but Joe is a big picture person. I mean, there is so much involved with this role that the financial aspect and how we operate is what we need to be focused on, not whether somebody likes him or not, because ultimately some of these groups have really no idea what's involved with running this hospital. So I don't want it to be a popularity contest because that isn't what it is, in my opinion.
Can I ask a question before I call on you? So looking at this, looking at sections 1 and 2, what I am not clear about is how we're going to, what the expectation is to weight each, if we're talking about weights of the goals, to weight each section, sections 1 and 2, because that's our portion of this evaluation, of this tool. So Is there any, could you scroll up just a little? One thing I didn't bring a copy of. So. The top is qualitative, 1 is qualitative, 2 is quantitative. Correct?
Yeah, it's delineated by quantitative and qualitative. The first 3 questions are scale and the second 3 questions are short answer.
So I guess, I mean, the one thing that I'm unclear about is how it all rolls together, how we as a, what the expectation is for how we roll the qualitative and quantitative in section 1 and the organizational goals into.
I see where you're coming from. So the idea would be to assign an overall rating based on the weighting of section 2, the quantitative scores in section 1, and then there's no real way to integrate the qualitative piece other than to inform, I think, goals for the following year.
Madam Chair,
Yes, Shelley, you were next on my list anyway. Thanks.
can I play devil's advocate and say, why do we have to weight them? You know, in my mind, these will change throughout the year. If we're doing well financially, then his focus is going to be somewhere else. You know, he has Joe's expanded orthopedic services, right? So that may not be his priority or our priority at the time because that's in place.
Hal was next and then Ken.
I want to make one point to directly address what Lisa said. Other people may give us information, other entities may give us information, but the CEO's evaluation only comes from the board scores. So the union has nothing directly to do with it, although it could influence board members. And the way I was imagining that when this is done, we would have a score for number 1, a score for number 2, some kind of score that would summarize the whole board for 1, 2, and 3. And then there would be the qualitative 1, 2, and 3 items there. And then there would be 1 score for organization and board goals. We don't have to do it that way. We don't need these weights. We could just have a score for organizational goal, 2.1, 2.2, 2.3. That would work well too. But I imagine we would have all these scores. The board would go into executive session and we would have to determine using judgment, because this isn't an algorithm, but using judgment, we would have to determine what we were going to then tell the CEO about his whether his score is excellent or what word we're going to use to describe the performance of the year.
So I think all along, I probably should have started with what Shelley said. Why do we need to have weights? I think that we have goals, but I don't know if we need to weight it. And I agree with that. I still do think that knowing what Joe thinks and everybody else thinks, and as we rate the scores, I really think that's more of a tool for us than, it might not change my mind, but it might make me think, if I have 40 different evaluations saying that something that I didn't know about is going on, because I'm not on campus. I mean, that's not what, all I know is what board meetings happen, committee meetings. That's all I can tell by. So I like the thoughts of not having weights, and I still really like the thoughts of being able to have the gathered information as much as possible. I do want to say one thing that I really like this new approach, though, to the evaluation. I think this is a really good job, a good thought. Just don't know that I like the weight process.
Thank you. And of course, Chad, Chad, say thanks.
Well, I know you got that too. Chad, of course, I appreciate it.
I second that proposal. I'm happy ditching the weights, but I also prefer more information and counter I would prefer more. I know there may be bias in it, but I'd like to read it just to get it.
It's kind of like, that would be my.
To the chair, if it's okay if I chime in, what the process could entail, do an evaluation like on your own, and then I could provide the data, and then you can do a secondary evaluation to see if anything changes. I mean, it's gonna be on your own anyways, so.
I don't know if I don't know if I want to turn my evaluation into you after before I've seen everything. I'd like to really see everything. I don't know what to do.
Dr. Trini.
Thank you. I guess I'm confused. Are we to evaluate as the board, we used to evaluate how Joe is doing in relation to his interactions with the board. We evaluating Joe and how he's interacting with staff. That's really, if that's the case, then yeah, we don't see that. We don't see any of that.
His overall performance, which includes all of it.
Everything.
Everything. His interactions with the physician, the provider community, with the staff, with the broader community, with it's his overall performance in his position, which is all pretty much all encompassing for this community. I mean, if you look at the criteria that we established for recruitment for the perfect candidates, it has all of those criteria as part of this position.
One other thought. So this is what came out of the governance committee. So this is forwarded in the form of a motion, really, even though we left the weights blank. If someone would like to modify it, I suggest you just amend this. If you want to take the weights off or change any wording, I suggest we just amend it. And
I would be more than glad to make an amendment. I'm not really sure how to word it, but I'll try to amend this evaluation that came out of the governance committee to leave those 6 goals there, but not weight them. And that we as a board, before we do our evaluation piece, that we get the pieces from the whole 360 evaluation to us before we put our evaluation and turn it into chat. Everyone.
Do the members, since this is a friendly amendment, I guess, the members of the committee, I'd like to hear from the members of the committee that voted on the original.
Madam President, I think the one thing that stands out as a question in my mind is if we're removing the weights and we just have a list of goals that are binary, yes or no. I believe that all the board members come up with the same score for that section.
If we leave the comments section, it's yes, no, and plus comments.
What score do you give yes and what score do you give no? This is right.
If you want to chime in.
I just my observation, it seems like there's kind of 2 discussions, right? It seems like some part of it is like the idea of weights. Honestly, it seems like maybe it gives Joe as much as anyone sort of an idea of what the board's feeling are. You come up with 6 goals, the weights kind of gives Joe an idea of what does the board find to be the most important. It sounds like, Hal's intent is, if you don't meet the 2.5 margin, which Joe maybe doesn't have any control over, if Medicaid reimbursement, that information all goes into what the board then comes up with. Those, even though those are binary things that maybe you don't have control over, it seems like ultimately the board's decision about how it's reviewed, you're not beholden to those yes or no. Right? That doesn't necessarily mean Joe would have bad margins. You would just take into account that piece. Is that a fair?
yes, this would be information that would be distributed at the time we sit down in executive session and come up with a description of Joe's performance.
like, so in theory, you could have not meet 2.5, but everybody could still say, well, Joe worked very hard to meet that, and there were factors outside of his control that didn't allow him to meet that. But we still say that that's a really important goal for us. Yeah. That's-
I'd like to propose along the line of Dr. Mather's discussion. We as a board could just fix the order of priority of these goals, 1 through 6, and weight them in that matter without a percentage that adds up to 100. So that tells Joe what our focus and what we want him to focus on as a priority. Your comment about the margin being the number one priority is spot on, and I agree with that. I'd much rather see it them just ranked as in our priority than assigning a percentage weight. If we're going to go that route, rather than do away with any kind of weighting or so I'd entertain some feedback on that.
Well, we would still need somebody to propose that.
Yes, and I'm proposing that number 1 is going to be the operating margin.
If you strip out, if you just take the ones, what I had described and just put them in rank order, we have the first one in rank order 1, the second one, I believe, is still in rank order 2, increase employee satisfaction. The physician satisfaction goes up to 3, and then the other ones go in some order. Probably what I had suggested is the orthopedic services falls to the bottom. But somebody else, I'd like to hear how somebody else would do it.
Well, I think that the decision of ranking or no ranking, regardless of what this, regardless of what the numbers look like, is the first question.
Well, we still have a motion on the floor. Now we're kind of drifting off, aren't we? Because we're talking about something else.
I agree with you now.
We're in the discussion of that friendly motion.
So first of all, I really don't want the weighted numbers, so I'm probably not still on the table here. I believe that all 6 of these measures are important. Okay, I believe that for the success of the organization, we all know that we need to have a margin, operating margin, because you can't succeed or continue to succeed unless you're making money. But I don't know if we necessarily need to rank them. I think that as a board member, I'm going to rank them in my own item that I feel that they're important as I'm doing it. You know, I think that if we have some outrageous behavior by a CEO, maybe not Joe, that could outrank even if you had a 5% margin, it could really outrank that. So I think that all 6 of these measures are really important, and I'm not necessarily sure that we need to particularly rank them.
So let's finish this discussion.
I need to comment. I did not realize this was an action item, so it's not listed as such. So you will cannot vote on it. That's right. Just want to make sure. You're talking about broken, so.
Okay. Well, that actually, I don't think this time.
Okay. That being said, thank you, Anita. A lot of the discussion. That being said, I'd like us to step away from this discussion. You can bring back your motion, or we can, but at the next meeting, and we've got time, Joe's evaluation isn't due for another couple of months at least. So we've got time to resolve this issue. So let's step away, think about it, and come to resolution at the next meeting. Does that work for you, Mr.
Me?
Yes,
Oh, that was just great.
Okay.
Yeah.
All right. All right, thank you. Any other commentary about the CEO's evaluation? Med staff report.
There is. So for the med staff, the big topic of discussion during that meeting was the action item on page 42. So one of the staff members a couple of months ago now raised a request for allowing for certified surgical assistants to assist in the operating room. I think this is something that in my looking back, which personally doesn't go all that far, but in talking with folks, we haven't had this designation of staff members working in our OR here. It is very common though throughout the state and throughout the US. So based on that request, the MedStaff office reached out to some other places locally in the state. Primarily Fairbanks is the one that mainly responded. And then we also reached out to a couple groups of lawyers to figure out what the best path forward was. And I appreciate Chad's help and the rest of Emmett's help with figuring that out, because it was not exactly clear to me, probably as much as anybody, what the best path forward was. But ultimately it came to that it should happen through the MedStaff office. And so that would require having us have another class people to credential. These individuals they'd be working independently. They would not be employed by the hospital necessarily. They could, but they can also work independently and bill patients directly. And so, yeah, we talked about it, came through credentials and then med exec and then the med staff and out of all of those committees. And so I guess if there's any questions about it, if people want more information, I'm happy to give that.
Any questions or comments?
Well, just a comment. So we have discussed this previously. We discussed this in the last meeting, and I'm just going to say I'm in favor. Or they would ask, do we need this as a motion since this came out of med executive? Then I would like to move.
It sounds good.
I would like to move the certified surgical first assistant privileges as described in the package.
I'd second that. We've had a lot of discussion about it. The med staff, there's no problems. We've been, if I may, we essentially had first assistants in various roles, including surgical technicians employed by the hospital. So this is just another step up with a little bit of extra training. It's a new category. The med staff at large is comfortable with it. So I really don't see the problem that the board would have.
Just making a quick comment, Dr. Manley, thank you for finding a path for this. This is really good work. I've been sat in all those credentialing meetings and stuff, and I'm just really glad that we're getting this. Very supportive.
Any other comments before we?
Sure.
Yeah. Okay, is there any opposition to this motion? Seeing none, this motion is approved. Thank you. Okay. Do we want to take a quick break? If you've been at it for an hour and 20 minutes, we've got a third of the agenda to go and then an executive session. We take a quick break, maybe somebody could get their multi-factor set up while in the next, let's give it 10 minutes. All right, everybody got session. Let's move on to the committee meeting updates. The planning committee and Cal stepped in for Henry. So Helen's going to,
Mostly what I'd say is the minutes accurately reflect what we talked about. I would have probably made some mention of the facility plan, but I think Joe's gonna talk about it. So, we just, well, you can see from the minutes what else we talked about. That's the most important thing. Maybe yeah. I'll just leave it at that, unless there's any questions.
no questions. Is the governance committee, which is also you have.
Okay, so here we are with another controversial item. So the policy manual has been in production here for months. We have a draft for you, but the ask at this time is that we're just going to present it and then we'll vote on it at the July meeting. So that will give people time to have a look at it. And propose changes if you want, or possibly even find some more mistakes and errors. But this seems like no matter how many I look at it again, I find it. So I should offer a prize for the person who finds the most mistakes and errors between now and the next meeting. Maybe I will. I'll try to think of something good for the person who finds the most mistakes and errors. But that's coming from the governance committee as a motion. We'll vote on it.
I see in the notes there that the next governance committee is probably going to be in August. Is that what you wrote in there?
I snoozed through that when I reviewed the minutes. I thought we were going to ask for a meeting in July.
So because it will come to this as an action item, not just to make a motion here. So it'll go one more time to the governance committee and then come back to this body.
No, the governance committee does not intend to look at it again. This just gives everyone a chance to be presented with it and look at it over the period of weeks. Instead of just have a few days to.
So it's kind of a full motion from the board.
The governance committee has seen a draft of it twice. Now it's coming to the board for its first reading and the motion.
Again, so the board will be making the motion, or it will come from the governance committee. That's it.
I see what you're saying.
Doesn't it come from the governance committee's action next month?
Okay, that's what I was wondering. So it's governance committee versus.
I don't know if anybody's had a chance to take a look at it. If you have, are there any comments or questions or so to give perspective during your mulling over period for the next month on the
Madam President, I would offer some comments. I think that as you review both of the documents that are in the packet, something that I think we tried to remain focused on is being succinct and clear. Some of the edits from the red line, you'll note that there's a lot of fluff where it came out to make it be a little bit more clear and a little bit more succinct. And I appreciate how you're working and guiding us through that. I really thought the governance committee was quite effective.
comments. Okay, seeing none. You have? Finance, audit, is someone stepping in for Max?
I can talk to it if you want.
Okay. That'd be great.
So the minutes accurately reflect the meeting.
I could have said that.
I would go over the highlights of the week. So during the month of April, we were able to move back into the black. So we had an operating margin of 0.7% for the month. Year to date, we are sitting at 3.8% for our operating margin, with a net gain for the year of 5.2%. So doing well financially. The months of May and June are looking well revenue wise as well, so we expect a bottom month there. It was our first month in next week, so there are some bumps, but Angela's gonna iron those out for me next month. Other discussion points is we spent quite a bit of time talking about the housing issue that we discussed earlier, so I'm not gonna go there. We had the Foundation on End of Life Care come and present. We talked about hospice and some of those 4-year projections. They've asked that we put a name forward to be part of their board. So I discussed that with Angela, and we've submitted her to potentially join their board as a member or liaison between us. And so I think that could actually happen. That's kind of the summary. Questions?
Then,
No.
CEO report.
CEO report. So I have a letter in here that kind of starts off with the downcast with it. What we've seen over the last couple of months is several of the large players in the Seattle area go through some pretty substantial layoffs. Providence laid off 600 employees, and then during their, in addition to that, they laid off 4% of their health, their insurance, the staff that run their insurance line as well. We saw 120 staff laid off from Virginia Mason, Peace Health had layoffs. So in preparation, due to the trying times we're currently in, it's driven, by tough reimbursement, driven by prior authorizations, insurance companies diminishing or paying for less services. There's a competitive labor market. We have tariffs going over us. We have Medicaid cuts going over us. So I think some of their cuts are in preparation for what's coming and the trying times they're continuing to go through. We've done a lot of the work getting to where we are. So the letter just, we need to remain diligent in our processes that we've put in place to help survive these times. I'm hopeful that we have a budget from the Senate committee, the Senate next week, what I've heard. So we know there's going to be cuts to the Medicaid funding at this point. So trying to get that in front of us so we can analyze that next to us and respond accordingly. That's just kind of the tone of the letter, just making sure that we understand that we're going to continue down the road, the path we've set, process going through our FTE committee, looking at staff, as well as doing all the other stuff that, value to our organization. Some of the other big things we're going to talk about in the letter was we're looking at OR block time. It was a big discussion at our last surgical care committee. We're kind of at the point where we're running our ORs pretty efficiently. The surgeons feel like we need more block time. So one of the things me and Kim look at the rest of the SLT is bringing on this additional anesthesia in the form of the CRNA so we can. We're also exploring other opportunities, expanded hours, weekend, all kinds of possibilities to add block time so we can get, our ORs up and running at a higher level. But as me and Kim just discussed, it doesn't do us a lot of good when we start running out of beds for those patients to go in case there are a couple patients. So the house has been full most of the month. Dr. Banner was here last week. I think he can attest to how busy we've been on the inpatient unit. So as we discussed critical access last year, at the university was decided to play it right now. As we're just getting cold. That's what we're excited. Does it really make sense this year? We'll continue to work on block time. Another thing that was we've been working on is the Spillberg Center. We discussed last month with the board. We have had meetings with CBJ and CCFNR and Gastineau Human Services. They are in discussions at this point. That was noted somewhat in the planning committee. We are doing a walkthrough with CCFNR and our staff through the COVID cabin on this Thursday at 3:30 to explore that option. In conjunction with GHS, looking at some space they have on their property that could be a landing spot. The COVID cabin. So we have a couple things working on a little update you as this continues to proceed. We did update the planning committee on family practice at that point. I don't have any further updates on that as of today. The piece that's in the packet, we do have a timeline set forth for the master facility plan. We will have the contractors on site the week of July 17th. We are setting up meetings to start that process. They've given us their document request, their information request, so we're trying to fill that as fast as possible. There will be some key stakeholders interviewed in this process. We're going through the identification in that process, so I'm going to chat with them and try to engage kind of the board's involvement in this process as well tomorrow, so we'll discuss that. But it will be coming at us relatively quickly. You can see the timeline kind of drags out. My question was, if they have all their information, could the report come earlier than the December timeframe? So we can start discussing implementing it and, amending our strategic plan to try to action some items that could come out of the facility master plan. And then Chad had some additional stuff in the admin packet to talk to on the staffing if you could.
So specifically, we're talking about the Duke report.
Yes.
So part of our, as we talked about employee engagement earlier this year, one of the things that we recommitted to as an organization was to try to provide more training opportunities and development opportunities for our staff. And part of that was we were able to partner with AHA, who gave us $40,000 to send up to 20 leaders through the Duke University Healthcare Leadership Certification course. And so there was a group of 16 people that got to participate in that. As you can see in the report, 14 of us made it through that process. And candidly, it was an incredible experience. I was able to be part of the first cohort, as well as Kim, and it was a truly wonderful experience being able to have some very candid conversations with staff. We specifically picked staff who were experienced leaders, some new leaders, and from a variety of both clinical and non-clinical settings. And what we found through this process is that not only was the training itself incredibly beneficial, but we added a layer onto it, which was a series of meetings that we had throughout the process. So for the first cohort, we met in the middle, and then we met again at the end. And coming together as this small group of 16 of us, we were able to really share ideas, thoughts, and to honestly be very vulnerable about some of the challenges that we've had as leaders. And again, I'm just super grateful to AHA for this. We were like the test subject to AHA to see if they wanted to do it. So what you're seeing here is also the report that is being submitted to them to kind of summarize our experience there. And what I want to highlight here is not only was this a great experience, but with the addition of our staff development team, we've kind of bifurcated our workforce and staff development groups. And in adding some additional support in the staff development side, we're in the process of developing both a tactical and practical leadership training that's very specific to Bartlett. And so we're really looking forward to that. We have a timeline set for August 11th for all the subject matter experts to provide their input for the training, and that tactical and practical aspects are going to be the gateway into this program. So once you've gone through the tactical and practical trainings, you'll be able to go to the strategic, which is Duke really covers that very, very well. So very excited about it. And it was a great experience. Kim, you want to add anything since you were there too?
Yeah, through the chair. It was really, as Chad said, it was a really good experience. And I think what was nice about it is it gave us, I think as leaders, we're so hesitant to show vulnerability. And this course kind of gave us that kind of permission of how important it is to show vulnerability to your team when you're making hard decisions, because it's important that your team understand like the decisions you're making aren't without thought or without feelings. It also highlighted, people were able to share stories about like I shared a story in my first job, my first day as CNO. I actually had to close my blinds and close the door because I was having a massive panic attack. Like, what did I just do? But it was helpful for others in the meeting to hear that, because as new leaders, they said, oh gosh, we were feeling the same thing. And we didn't know, like, that's just kind of normal. I don't know if it's normal for me, but so it was a really good opportunity to just have open and really actually vulnerable conversations with other leaders. And then everybody kind of gained a lot from the new leaders and processes. I learned stuff from Chris of how he ran stuff like his calendars and what made it less crazy and hectic. And I was like, oh, I'm going to adopt that. And so it was a really good opportunity for all, as Chad said, all levels of leadership to come together and really build on each other's strengths and weaknesses.
Any questions?
So I think you said you had funding for 20, but then I believe it said 16 enrolled.
Yeah.
And then I think it's further, 14 made it all the way through.
So we had 20 people originally that were going to participate. 4 backed out due to just a variety of personal and professional timing issues that just didn't sync up with them being able to commit. It's a 12-week course. In the initial conversations, they said, oh yeah, it's an hour or 2 hours a week. It's not too bad. It really, the more you dove into it, the more you gave to it, the more you got back. And so I think most of us were spending 3 to 4 hours a week on this. Because the discussion board portion where we were posting on topics became such an incredible source of information and communication that we spent a lot more time. So, and then unfortunately 2 people just didn't complete the course in time. And so they weren't able to get the certificate. So.
Is there any other questions for my report too?
You know, I was in a doctoral program for organizational leadership. Is this something that would be beneficial to a board member that was interested in participating? Does it have to be different leaders? I mean, because I consider us leaders, and I think we're all requiring education.
It's something we can dig into. If we can look for other board education too. I know we're going to start working on the education plan for the boards and the governance committee. So it's something to explore.
I believe that this is something that AHA just mostly wanted to do for employed staff. So.
Oh, no, I was just thinking about at some point down the line, you know, I don't know. I mean.
Sure, this is the right thing for a board member. But I believe that, like Joe said, there's always other education opportunities, but I don't think this is one.
Oh, that's fine. I just asked a question.
Heather? Thank you all. Hey, Mr. Steiniger?
Hello. Thank you, and sorry for being remote today. Apologize for that. So a couple of things. We covered the bigger topics at our last assembly meeting, which was back on June 9th. We did our final passage of the city budget. I think I covered a lot of the kind of details of that in our last board meeting here. Kind of a high level end result is a mill rate of 10.24 mills. It was a final mill rate that we adopted. We also moved forward on the plan to demolish the properties that are on Telephone Hill and do the site preparation work to get that ready for redevelopment. So that's those were our 2 big topics on June 9th. Kind of looking forward to what we have coming up. We're having continued discussions about moving city elections to a form of ranked choice voting, somewhat similar to the state level. Kind of the biggest nuance that we're having discussions about on that, though, is at the city level, we have a lot of elections that are picking multiple candidates from a group, what's called block voting. And there's a bunch of different ways you can do that within ranked choice voting, and a lot of kind of pros and cons to each different option, including the status quo. And so we're still having some discussions on that and how we look at that as we move forward. We also have a number of ballot initiatives that will be on the ballot this coming year. There were 3 voter initiatives that look to be approved. I don't know that there's final word yet, but I think there would have to be quite a few signatures rejected for them not to make it on the ballot. So those are one that would repeal mail-in voting, one that would set a cap to the mill rate, and one that would create exemptions on food and utilities for sales tax. We're also working on a initiative on an ordinance at the assembly level that would be similar to the sales tax exemptions, but balance it out with the seasonal sales tax to ensure that city revenues wouldn't decline as a result of the exemption. We also had a special assembly meeting yesterday to make some board appointments and do board interviews for docks and harbors, as well as the planning commission, and made some appointments there. We have 2 of our boards that we're currently recruiting for that we had to extend the recruitment on. That's the airport board and Eagle Crest board. So if anyone knows anybody that they think might be good for either of those 2 city functions, airport or Eagle Crest, definitely let them know that we're still looking for applicants. We've got more seats and applicants as far as the last update I received on that. And then in the committee of the whole, we also had an update on solid waste in Juneau. As I'm sure everybody's aware, the dump is kind of nearing its end of life stage. And so we're starting to go through options for kind of moving forward from there and what the options are for the city to kind of replace that once that resource is gone.
Are there any questions for Mr. Steininger? Thanks for that update.
Thank you.
Okay. This month by. It seemed like it was just a week and a half ago that we had the last board meeting. A lot has happened, and there's been a lot of some of which we talked a little bit about that were just coming to light at around the time of the last board meeting and some of the committee meetings. Joe and I've had more than one meeting with each other. We yesterday met with the folks from Juneau Bone and Joint to hear some of their concerns about the expansion of orthopedic services in Juneau. We didn't, it was a productive meeting. I don't think we came to a conclusion and a full process moving forward, but I think it was a productive meeting. So all in all, it was a bit of a whirlwind of a month. I don't know. John, Hal?
Yeah, I have to speak. So the themes of the meeting were Juneau Bone and Joint. They're upset because they feel like the hospital is bringing in people to do some of the things that they already do. And so the big budgeted hospital is advertising. The advertising really got under their skin. The problem is that what we tried to articulate is that we were trying to stop the leak of orthopedics who did not want to go to see JBJC. But the problem is when you bring in somebody who's, say, a fellowship trained arm and shoulder, they're going to do some of the simple cases as well, which these guys can do. So in a sense, we are subsidizing competition to steal from the people that live here. But there's that, we have this dual mandate to support our local physicians and yet support our hospital, the community members and giving them the best care. So that's a fine line that we have to sort of walk. I would say that's, from my perspective, was the nutshell.
I think there's more work to be done, and with our relationship, and more discussion to be had among the board as well. And there are a couple of things that we're considering with regard to getting community input on moving forward with what the community's needs are for its healthcare choice. So more to come on those things. So as I said, was a busy month, and it's probably going to be a busy month next month for all of us, those who want to play in the sun and the other things that we do here. All right. Do you have any questions for me? Hearing none, let's move on to the calendar.
True. Could we get a governance committee meeting looked into? We have a few things like the education. We have a few things left that we need to get done before the fall. And so I think all the governance committee members are here. All right.
Do you have a proposal?
I don't, I'd like to hear what other people say, because I probably have fewer constraints than other people do.
Let's do that. So it's really the, yeah.
Anybody else on the committee have a suggestion?
I could avoid the first 2 weeks, that would be nice, just because I'm on call.
I was going to suggest Thursday, the 17th.
No.
No.
Well, that's when the MFP folks are gonna be here.
Oh, that's right. So it is master plan folks.
That would be covered by things.
I mean, Monday or Wednesday is okay. Okay. I mean, do you want to do this before the board meeting, or you not?
I think that's not that necessary. It's not that necessary. We don't have anything that really needs to get for next month.
So you want to use that next week again?
For the policy game. Oh. Yes. Do we need that since that already came out of the governance committee?
It needs to come out as an action.
Okay.
Just procedural.
So let's see, the next board meeting, I believe, is that the 22nd?
Yep.
And you need to get it advertised. It's 17th will work. 16th? 16th, yeah, how about that? I'm busy at 10. Can we do the 16th at noon? Does that work for you? Okay, let's do that.
Does that need it?
Oh, they're here, but we don't have any.
Yes.
How long do you want to schedule it for? How I'll make sure that I have the whole time. I'll have the whole time available if it's, you think it's going to be closer to 2 hours?
No, let's not go that far. So.
Okay.
Okay, so we've agreed on noon on the 16th.
Yeah.
I'm confused. I'm apologizing. I can't answer that. I thought that June was the month that we canceled the policy committee, so I was late. So July. And we agreed. We agreed on that last month. Finance, I believe those of you who were solid with the 15th. Okay.
Can I move quality to 3:30? Just because I'm doing surgery on that day, so that was. Everybody now, sure, Shelley's knows that, I think. Shelley runs it. Shelley, can we move quality on July 10 to 3:30?
Yeah, I'm fine with that.
Okay. Any other changes to be made? I'd entertain a motion for the, to approve the calendar.
Make a motion to accept the calendar with the minor changes and the addition of governance.
Second that.
Any objection? The calendar is approved. Any board comments or questions?
Madam Chair.
Yes.
I just want to say thank you to you and to Al for covering for me for emergency, had to go out of town for missing the planning committee and the notes were great, so I felt like I didn't miss. But I really appreciate you guys doing that.
We were happy to do that. And I'm really happy that Hal agreed to cover for me while I was in transit. Yeah.
Once again, I'd like to thank Bartlett for bringing another grandchild safely into Juneau. And so, yeah, I've got a new granddaughter. And my elder granddaughter, who also was born here, was so pleased to announce that her sister's a girl. What she was hoping for. So,
Congratulations.
yeah, well, I deserve none of the credit, but thanks to Bartlett Hospital, which does deserve some of the credit, and also Valley Medical, which deserves some of the credit too.
Any other comments or questions? Okay. I would entertain a motion to, does anyone want to take a quick break before we go into executive session?
Yeah, 5 minutes, is that okay?
How about if we move to go into executive session after 5-minute break? Let's make the motion now. And we'll have a 5-minute at ease.
I'm searching for the wording. Do I have the wording?
I could do it. I move that the board of directors of Bartlett Regional Hospital recess into executive session to discuss several matters, those of which by law, municipal charters or ordinance are required to be confidential or involve considerations of record not subject to public disclosure, specifically the credentialing report, med staff meeting minutes, patient safety dashboard, and legal.
Second.
Any objections? Or
Does anyone want Chris, but he's still here? We have
Record?
Yeah.
Madam Chair, I move that we accept the credentialing report.
Second.
and no objections? Any other comments? And I believe we are adjourned at 8:21. Or 2, whatever that is. All right, you guys.
Good.
Don't mind that.